Hello friends, myself Meenu and we are going to continue the part 2 of skeletal system bones of the forearm and hand. So let's go ahead and today's topic is radius, ulna and bones of hand. Here you guys can see this is the radius, here is the ulna bone. This is always lateral side. You can see this by your thumb where your thumb is situated. You can feel that is the radius bone. Okay, here is the wrist region and this is the elbow joint. Here upper continuing is humerus. We have discussed in previous lecture about humerus, clavicle and scapula. If you guys don't have watched, just go and watch that also. And now let's see about radius. And radius is a lateral bone. I have asked you priorly also. And this is the ulna. Its upper end includes head, neck and radial tuberosity. Upper end includes head, neck and this is the tuberosity, radial tuberosity. The superior surface of head articulates with capitulum of humerus to form part of elbow joint, and circumference of the head articulates with radial notch on proximal end of ulna to form proximal radioulnar joint. Okay, so here we can write this. So let me write. You guys can make your notes. Just write points. So radius is a first point. Radius is a lateral bone of forearm, and second point, its upper end includes head, neck and radial tuberosity and the superior surface of head articulates with capitulum of this is the symbol of width, and sorry, let me write it with capitulum of humerus and to form part of elbow joint, to form part of elbow joint. Okay, let's move another point. And circumference of the head articulates circumference of the head articulates with radial notch on proximal end of end of ulna to from proximal radio-ulnar joint, to from proximal radio-ulnar joint. Okay, we can write this in short, PRUJ, proximal radio ulnar joint. Okay, now let's no we need more space to write our points, so I am erasing this. Okay, it lowers radius lower end, radius lower end has inferior articular surface which articulates with scaphoid laterally and lunate medially Lower end also has ulnar notch for articulation with head of ulna to form distal radio-ulnar joint. So lower end has also ulnar notch for articulation with head of the ulna to form distal radio-ulnar joint. And let's see muscles attached to the radius. Here is the origins from ulna. These are flexor pollicis longus, let me show you in the picture. Flexor pollicis longus, this is the originating muscle number 1, and abductor pollicis longus, this is also the originating muscle. Extensor pollicis brevis, this is the third muscle which is originating from here. And flexor digitorum superficialis, so this is the fourth muscle originating from here. Flexor digitorum superficial muscle. Okay, here is the point so that it could not be cutted. And let's see inserted muscles of bicep radius. These are biceps brachii. So this is the first, which is insertions, and this is on radial tuberosity. This is radial tuberosity. And supinator muscle also insertion. So this is also insertion. Pronator teres also insertion. Third, pronator quadratus also insertion. Fourth, brachioradialis also is insertion. 5. Okay, let me erase this first here. Now fifth, this is on radial styloid process. Brachialis muscle on radial styloid process. Okay, so now dorsum of lower end of radius has dorsal tubercle of radius. Here you can see has dorsal tubercle of radius, Lister's tubercle, which can be palpated in the line with the cleft between the index finger and middle finger. The groove medial to Lister's tubercle is transversed by tendon of extensor pollicis longus. The groove lateral to Lister's tubercle is transversed by tendons of extensor carpi radialis longus and extensor carpi radialis brevis. And this is the very important point here, point to be noted, my lord, because this has come previously in many examinations. Okay, so I'm highlighting this and just note these points. Okay, so let's move ahead. Now we will study about ulna. So ulna is a medial bone. This is the medial side. So it's medial. Proximal end consists of coronoid and olecranon process. Let me see. So proximal end of ulna consists of coronoid and olecranon process. Here is the coronoid. This is the coronoid process and this is the olecranon process, and a trochlear notch also. This is the trochlear notch. Okay, radial notch is present on lateral aspect of coronoid process. So this is the radial notch in the lateral aspect of coronoid process and articulates with the head of radius. Trochlear notch articulates with trochlea of humerus to form medial part of elbow joint. Okay, distal end consists of head and styloid process. Distal end consists of head of ulna, and this is the styloid process. Head articulates with ulnar notch on distal part of radius. Head articulates with ulnar notch. Okay, so now let's see muscles attached to the ulna are here we would see some insertions. So insertions on the ulna is three muscles. Number 1, triceps. Number 2, anconius, and number 3, brachialis. So now we will see origins of the muscles from Allah. These are flexor, digitorum profundus. Second is pronator teres. Third is flexor pollicis longus, and this is on small ulnar head. And next one is flexor digitorum superficialis. Flexor digitorum superficialis. So, and this flexor digitorum superficialis is on small ulnar head. Okay. So next one is is muscle which is originating from here is supinator muscle, then abductor pollicis longus, abductor pollicis longus, and then next one is extensor indicis, and last one is pronator quadratus. Okay, so ulnar is completed. Now let's move ahead to the bones of hand. And the hand consists of carpal bones at wrist, metacarpal bones in the palm, and phalangeal bone in the digits. Okay, let's see the picture of hand bone. Okay, so these are the carpal bones, and these are metacarpals, 5, and then these all are phalanges. Okay, now let's see carpal bones. Carpal bones are short bones, 8 in number. These are 8 in numbers and arranged in 2 rows, proximal and distal. Each row presenting 4 bones from lateral to medial side. Bones of proximal row are, in the proximal row there is scaphoid, lunate, triquetral, and pisiform. These all are in the proximal row. And is the distal row, these are trapezium, trapezoid, capitate, and hamate. So let's see fusion of these bones. Capitate ossifies in 1 year, hamate ossifies in 2 years, triqueter ossifies in 3 years, lunate in 4 years, scaphoid in 5 years, trapezium in 6 year, trapezoid in 7 year, and pisiform in 12 year. This is very important and this should be learnt very in your fingertips. Okay, and now let's see articulations of various carpal bones are scaphoid, articulating with radius, trapezium, trapezoid, lunate, and capitate. Lunate articulates with radius, capitate, hamate, scaphoid, triquetral articulating with hamate, lunate, and pisiform, and pisiform articulating with triquetral. Minimum articulation with only one bone. This is important question. If the question comes in your exam, which bone has minimum articulation with only one bone? So which bone is this? This is pisiform. So keep remember. And next, trapezium with scaphoid, trapezoid, and first second metacarpal. Next is trapezoid. This is from with the scaphoid, trapezium, capitate, and second metacarpal. And next one is the capitate with scaphoid, lunate, trapezoid, hamate, second, third, and fourth metacarpal. So this is also now very important because this has maximum articulations with 7 bones. So this also can come in your examination, and they can ask which bone has maximum articulation with bones. So capitate has maximum articulation with how many bones? These are 7. And now hamate articulating with lunate, capitate, triquetral, and fourth and fifth metacarpals. Okay, now let's see Bennett's fracture. Some important points, but before this we will also know some very important things, and these will be discussing here. There are 4 bony pillars at the 4 corners of carpus. All attachment are to these 4 pillars. The number 1 pillar is the tubercle of the scaphoid. The tubercle of scaphoid. Number 2, and in between this, the flexor retinaculum. Here is the first point of this. These are pillars. The flexor retinaculum, and the second point is a few fibers of the abductor pollicis brevis. A few fibers of the abductor pollicis brevis. And the second pillar is the pisiform gives. Second is given by pisiform and is 4. 1, 2, 3, and 4. Flexor carpi ulnaris. Number first is flexor carpi ulnaris. Number second is flexor retinaculum and its superficial sleeve. Flexor retinaculum and its superficial sleeve. And the third one is abductor digiti minimi. Third one is abductor digiti minimi. And the fourth one is extensor retinaculum. Just write with me. Extensor retinaculum. Okay. And now we will see. So we have space became less, so we have to erase this and we have to see the third pillar. So third is the trapezium. Third is trapezium. So with the trapezium there is number first is the crest gives origin to the abductor pollicis brevis muscle. The crest gives origin to the abductor pollicis brevis muscle, flexor pollicis brevis muscle, and opponens pollicis OPPNENS opponens pollicis. These constitute muscles of the ulnar eminence. These constitute muscles of the ulnar eminence. So let's see the second point of this trapezium muscle is the edge of groove gives attachment to the two layers of the flexor retinaculum. The edge of groove gives attachment to the two layers of the flexor retinaculum. And the third point is the lateral surface gives attachment to the lateral ligament of the wrist joint. Lateral surface gives attachment to the lateral ligament of the wrist joint. And the fourth part is the groove lodges the tendons of the flexor carpi radialis. Groove lodges the tendons of flexor carpi radialis. Okay. And the fourth pillar is hamate. So fourth pillar is what? This is hamate. And about this, the tip of hook gives attachment to the flexor retinaculum. A tip of the hook gives attachment to the flexor retinaculum. column muscle. And the second point of this is the medial side of the hook gives attachment to the flexor digiti minimi and the opponents digiti minimi and opponents digiti minimi. Okay, and now metacarpal bones are miniature. Let me write here for your understanding. Metacarpal bones are miniature long bones, 5 in numbers, and are numbered from lateral to medial side. Let me show you with the diagram. These are 5 metacarpals are 5 miniature, and these are long bones, and 5 in number and numbered from lateral to medial side. So this is the lateral side, this is the medial side. So if we will numbering from lateral side, so this is the first, second, third, fourth and fifth metacarpal. This is how we continue. Each metacarpal possesses of diaphysis and a single epiphysis. Okay. Unique property among the long bones, as most of the long bones have 2 epiphyses, but in this there is the single epiphysis. The epiphyses of all metacarpals are directed towards the head, except in the first, where it is located towards the base. Head of metacarpals articulate with proximal phalanges, forming MP joints, knuckles. So this is the knuckles, mediophalangeal joint. Okay, and let's see to the phalanges. And phalanges are 14 in number, and 3 for each 4 fingers. This is the 1 2 3 1 2 3 1 2 3 1 2 3 and 2 in the thumb. And these bones are referred to as proximal, distal and middle. This is the proximal, middle and distal. Proximal, middle, distal. Proximal, middle, distal. Proximal, middle, distal. Okay. Phalanges are miniature long bones and possesses diaphysis and a single directed towards to the base, like the first metacarpal bone. Okay, let me erase. There is a great mess up. Now write, this is very important point. Like first metacarpal bone, phalanges have a diaphysis, and a single epiphysis. Okay, just write it down. I am just erasing this because picture is gonna to be dirty. Okay, now let's see some very important points. Knee walk, in the knee walk disease is osteochondritis of lunate. These are the points you guys should be known about these. In the knee walk disease is osteochondritis of lunate. Capitate is the largest carpal bone First carpal bone is to ossify and articulate with the maximum number of bones. This is lunate is the most commonly dislocated carpal bone. Scaphoid is the most commonly fractured carpal bone. And now Bennett's fracture dislocation is an oblique intra-articular fracture of base of first metacarpal with dislocation of carpometacarpal joint. Bennett fracture dislocation is an oblique intra-articular fracture of base of first metacarpal with dislocations of carpometacarpal joint. And now Rolando's fracture is extra-articular fracture of the base of first metacarpal. And Boxer's fracture is the fracture through the neck of fifth metacarpal. And these all points are very important, so just keep in your fingertip for your examination and for your personal knowledge also. Okay, so now I am done with this. In the next topic I would discuss about joints. So bye bye, see you soon in another video, and like, share, subscribe this channel and see this video, enhance your knowledge. See you soon, stay healthy and happy. Bye bye.